Dr. Larry Burchett, and welcome to your 5-minute weekly coronavirus update for July 31st, 2020, powered by Averpoint.com. This week we discuss good old hydroxychloroquine as treatment, as it's been back in the news again. A simple blood test, Lymphs, that could help your doctor both diagnose and predict severity of COVID. And we begin, as we always do, with the numbers. This week with Shovik Banerjee. Shovik?
500,000 Americans tested positive for COVID-19 this week. Now, daily positive cases have tripled from 20,000 in early June to 65,000 in mid-July, but this number has been flat for about 2 weeks. Hospitalizations have doubled from about 28,000 in late June to about 56,000 in mid-July, and this number has been flat for about 2 weeks. But sadly, deaths have steadily gone up from 500 3 weeks ago to about 1,000 a day this week. Now, regionally, the story remains big numbers in the South and the West. The ICUs in Florida and Georgia are at about 90% capacity. But these regions may have hit a plateau in terms of new cases and hospitalizations. Arizona, a hotspot 3 weeks ago, has seen days of steady declines in hospitalizations and new cases. Now, the Midwest is seeing its second rise. And rural America, where the virus has been spreading for weeks, is starting to see hospitals fill up, less equipped hospitals, where they have a harder time transferring patients because the next hospital is far away. Now let's talk about the world. Globally, we reached 17 million coronavirus cases this week. The United States and Latin America are the fastest growing regions. But let's talk about 6 countries that had contained the virus and this week saw sudden outbreaks. South Korea, widely praised for rapidly testing and containing the virus back in the winter. They saw 131 cases out of nowhere this week, the most since March. China saw 61 cases in a day, the most since March. And Vietnam, which has 438 cases total, 0 deaths total, saw 15 cases in 3 days, the first community spread they've seen in months. In Europe, they've seen week after week of decline. But Spain saw a 90% increase in new cases in 7 days. France, a 50% increase. And Germany, a 30% increase. So, 2 takeaways from this. Number 1, constant vigilance. You can never let your guard down with this virus until there's a vaccine or herd immunity. Even a place that seems to have containment can quickly see an outbreak. Number 2, testing capacity. When you have an outbreak, if you have widely available, rapid and accurate tests, you can quickly test anyone that's come in contact with an infected person. And you can keep your economy open. You can keep your airports open and test people that are coming in. Now, sadly, the United States does not have a national testing strategy. We've also hit testing capacity at about 800,000 tests a day. So let's hope that our leaders and our labs can coordinate, develop a strategy, and contain a future outbreak.
Hydroxychloroquine is back in the news this week with a group of doctors in their white coats on the steps of the Supreme Court. You probably saw this video. It went viral. Claiming that there is a cure, that hydroxychloroquine is a cure for COVID. Politics aside, let's review where are we at today with the following question. Is hydroxychloroquine an effective treatment for COVID-19? We're not talking about prevention. We're talking about somebody who's sick with COVID. First of all, what is hydroxychloroquine? Known by the brand name Plaquenil, hydroxychloroquine, it's been used as a malaria prevention medication and to treat autoimmune diseases like lupus and rheumatoid arthritis. Early on with COVID, it was thought hydroxychloroquine could potentially be an effective treatment, as evidenced by a Chinese in vitro study in March. We used it because although the evidence was weak, it was the only thing we had. What we needed was better studies. A French study came out in March that although small, it seemed to show, again, some benefit. So we kept using hydroxychloroquine, waiting for better studies. You may have heard of the Ford study. Although retrospective and observational, both weaker forms of evidence, it did show potential benefit. But ultimately, even Ford's study concluded that prospective trials were needed. Again, better prospective studies finally started to come in, and here's what we learned about hydroxychloroquine. A May British Medical Journal study, no benefit and possible harm. The June 2020 recovery trial from the United Kingdom, no beneficial effect of hydroxychloroquine. A New England Journal article this week which concluded hydroxychloroquine did not improve clinical status. No benefit, no benefit, no benefit. Further, an NIH study was stopped in early June stating that hydroxychloroquine was unlikely to be beneficial. Don't forget, to stop a study, the evidence needs to be convincing. That's a big deal. Similarly, a World Health Organization solidarity trial was stopped early for the same reason, no benefit. All of this taken together led the FDA to revoke the emergency use indication for hydroxychloroquine for COVID patients. Why? No benefit, no benefit, no benefit. By now, you get it. I'm beating the dead horse. Some consider this repeatedly demonstrated lack of benefit is overwhelming against hydroxychloroquine. At the very least, it far outweighs any studies that have suggested hydroxychloroquine helps. I don't know any of my colleagues now who are using hydroxychloroquine to treat anybody who's seriously ill with coronavirus. Most doctors aren't using it. Why? Because there's no benefit. This is how science works. Sometimes studies show maybe there's some benefit, and then we do better, stronger studies. The truth tends to be replicable. So to answer our question, is hydroxychloroquine an effective treatment for COVID-19? I hope you know the answer by now, according to today's body of evidence. And the answer being no benefit, no benefit, no benefit. Okay, I want to tell you about this really simple blood test called the lymphocyte count, which can help doctors both diagnose COVID and predict the severity. What is the lymphocyte count? It's part of a CBC, very common blood test, complete blood count, where we get white blood cells, which fight infection, you know that. Red blood cells carry oxygen to tissues, and if it's low in a CBC, that would mean anemia, so you check that blood count. We also check for platelets. Lymphocytes are part of the white blood cells. They're one of 5 kinds of white blood cells, like neutrophils, basophils, lymphocytes. They're commonly found in lymph tissues. That's why they're called lymphocytes. And they include things like T cells and B cells. You've heard of those, right? Well, with COVID, these lymphocytes, the level is low. Most of the time, I never check that. It doesn't give me a lot of information. I don't really look at that very often in figuring out what somebody's got. But with COVID, when I was in New York in the surge, everybody had it. Coming back to California, I would observe this and I would see, oh, lymphocytes low. That's interesting. I wasn't thinking about COVID in this patient. And I would go back, talk to them again for potential exposures, think about doing the test. It helped me catch COVID in more than one patient where otherwise I would have missed it. So this low lymphocyte count in a CBC can help us not only diagnose, but it's been associated with severity. So if the lymphocyte count is less than 1.5, people have 3 times the risk of ending up in the ICU and with kidney failure. An article in the journal Nature also showed that the low lymphocyte counts is one of the most consistent predictors of diagnosis, severity, and even death. So the next question is, why is the lymphocyte count low in this viral disease? There's 3 ideas that I want to run by you. Number 1 is just the virus directly kills lymphocytes. That's part of how it works. Number 2 is that our own immune system reaction, the cytokine storm, results in lower lymphocyte levels. And then the third idea is just that they become exhausted, that we run out of T cells and B cells fighting COVID. Whatever the reason, I think this is really interesting scientific stuff to geek out on, because not only can it help us with diagnosis and prognosis as we learn about COVID, but we could potentially use therapies to target it, to prevent it, and to treat it. And that this knowledge, this science, could result in saving lives. That's just really cool stuff. Love it. For Shovik Banerjee, I'm Dr. Larry Burchett. Thank you for stopping by to watch our 5-minute weekly coronavirus update. Please share this. You can check out the evidence for yourself at averpoint.com. And as always, stay safe, take care of yourself, do your part, and we'll see you next week.